Hello, thank you for joining in and taking time out of your very busy day or very busy moment to listen to this video on aging well at home. I'm Caitlin Clark, and I'm the Administrative Director for Post-Acute Services here at Hill Country Memorial. I have the pleasure and the opportunity to work with our post-acute lines, and for those who are not familiar with what that is, those are the service lines that help after you've had some kind of recent hospitalization or maybe a new diagnosis or a change in recent healthcare conditions. So these are the service lines that are designed to keep you safe and at home. I've worked my entire career specifically dedicated to service lines that help others stay aging in place is what I would call it. So today I want to talk to you a little bit about just that, the myths and the facts of aging well at home, and some things that we can do to try to help support you. So what we'll cover today are in-home support services. Those include a wide variety of services, including home health, home care. We're going to talk about the difference between the two, private duty, outpatient therapy services, hospice services, or in the event that you do need more support than what we can offer while you're in your home, other opportunities for placement or other places that can help there too. We're going to go through, or there will be an attachment to this on a checklist for how to qualify for some of these services, and then Q&A really comes in the form of you reaching out to me. I am putting this out here just as an education or informational based on some requests that I've received, but you're welcome to contact me if you have any additional questions, support needs, opportunities, or thoughts that you'd like to share back with me. I'd love for this to be a collective or a collaborative conversation, and so at the end I'll give my information, and please don't hesitate to reach out. I'm here to walk with you on this journey. So in-home services, I want to talk for just a second about what is home care and what is home health. A lot of times you hear those two words spoken interchangeably. You'll hear home health and you'll hear home care, but those are actually two very different service lines. Home health is typically a Medicare paid for or commercial payer, commercial insurance paid for home health service, which means that it is interdisciplinary. We have skilled nurses, physical therapists, occupational therapists, speech therapists, social workers, aides, all who work in a collaborative team in partnership with your physician to help provide the best possible care in your home. Private duty or home care services are typically just that. They're private pay services, and they are not normally covered by typical insurance or Medicare Advantage plans, although there are some advanced aging plans or aging in place plans, long-term care insurance that can help to support these services, but they're a little more unusual to have paid for through an insurance provider. Things that can be covered under home care are things like helping with dressing, helping with meal prep, grocery shopping, light house duty, just helping with sitter services is what we call it, but support in your home. So who's eligible? And I want to go back to home health for a second. Our home health services are designed for people who have either had a new diagnosis, so they now have an illness that they didn't know that they had previously, had a complication or a change in their health status. So maybe recently you've had a hospitalization, or recently you've needed extra support around the house because things just aren't exactly the way that they were before. It could be that you have a new wound, or perhaps infusion, which is our version of IV in the home, or any kind of medical complication or medical illness. Could be just general aging. So you were once able to do all of these things, but now are struggling more to be able to perform those things at home. That would all possibly be covered under home health services. Home health, like I said, is covered by insurance typically. Right now, Medicare and Medicare Advantage plans cover home health at 100%. It's one of the only places left in healthcare where we have no copay and no deductible for the services that we provide. And I would say that the reason for that is because we have proven in home health to be a very valuable partner in aging well at home. And when we look at the trajectory of Medicare and we look at where we are as a society, we know a couple things. We know we have a lot of people who are aging into the system and now qualify for Medicare services that didn't previously. We also know that we need to be as efficient as possible in our healthcare service delivery model, and that we need to help support people to be as strong as they can possibly be. And where people want it the most is at home. And so what I would tell you, or what I would argue with anyone, is that Medicare is incentivizing people to take advantage of these services, and take advantage of these services now by not requiring any kind of copay or deductible for the care that's provided. There are a few requirements for home health services. The first requirement is that we be in partnership with a physician. So we're designed to be an extension of your physician's office. Which physician? It just depends on what medical condition that we're coming to help with. It could be a wound care clinic or a wound care physician. It could be a primary care doctor. We oftentimes see people for frequent falls or for general decline or more weakness. It could be a cardiologist with congestive heart failure, or perhaps a pulmonologist for what we call COPD or any other pulmonary issue. So really, any physician can help refer to home health services. It's just a matter of what we're going to be partnering on to try to help keep you safe at home. So when I talk about a medical interdisciplinary team, we're talking about their skilled nursing, and our skilled nurses in home health are some of the strongest nurses in our healthcare system. When I say that, I mean it wholeheartedly, and I recognize that I'm biased. But when we look at healthcare today, we oftentimes have nurses who work in all different types of areas. And what our home health nurses do is they are trained specifically to help with chronic disease, with wound care, with IV infusions, with all types of medical issues that are happening, and to treat people where they are and how they want to be treated in their home. I have a great passion for our nurses in our home health world. The next would be physical therapists. We work with physical therapy in home health for lots of things: strengthening, weakness, what we call abnormal gait, which is just walking in general, helping people to stand up straighter, to walk easier, and to be safer. We work a lot on fall prevention in the home and give tips and tricks on how to make sure that we're staying safe as we age in our home. Occupational therapy plays a very important role in home health services. Occupational therapists help us with all of the activities of daily living that each of us do every day, getting in and out of the bath, helping to make sure that we know the safest way to do that, putting on our pants, buttoning our shirts, helping us to prepare meals or eat in the best ways that we can and in the safest way possible. When we think about what occupational therapy was designed for, in the home is the best place to do it, because it's right there at the point of where the actions actually happen. We have home health aides. They're an added layer of support to anyone on home health services. They help with bathing. They help with some activities of daily living. They can help with some light housekeeping, although typically under a home health service, they're there primarily to help make sure that you're safe as you recover in your home. Then we have social work. I love social work. I actually have a bachelor's in social work, and one of the things that I love most about our social workers is that they really help us in home health to review long-term care planning, to go through what are your wishes and what are your plans and how can we help you along that journey, and making sure that you're prepared for the future and what's to come. So all of the services come together to create a very interdisciplinary team and approach in coordination and in collaboration with the physician, like I said a moment ago. So trying to make sure that you have all of the education, the equipment, the tools that you need to stay safe at home. One of the most common questions I get from home health, or one of the questions I've heard most often in my career, here has been from someone that I'm calling to say, hi, we've received a home health referral, and I'm met with hesitation on the other side of the phone and say, I don't want to leave my home, I don't want to go to a facility. And what I would say to you if you're worried about that is, that's our goal too. Our whole goal is to keep you safe at your house as long as possible, and hopefully for the duration. So I would just say, if you're nervous about that, our goals are aligned. For private duty, or what we call home care services, those really are at the discretion of you and your family. So home care, or private duty, is a private pay service, and it's designed specifically to help meet your needs, whatever they may be. We know with home health, we're there to help with restorative care, or to help you better be able to take care of yourself, and it's short term. Private duty or home care services are designed to be as long as you need them. They could be forever, to be honest, but we help with bathing, again, light housekeeping, meal prep, grocery shopping, all of those things, getting dressed, brushing hair, brushing teeth, all of those things are under our private duty services. Private duty or home care is typically, like I said, private pay, and home health services are typically going to be paid for by insurance, whichever insurance that may be. Out-of-home placement options. So if you get to the point where perhaps there's something that's happened, I know that personally I have family members who've had a heart attack or a stroke, or who've had some other significant medical issue, and they're in the hospital and they're ready to leave the hospital but not quite ready to go home. I want you to know we have partners outside of the home to help with those transitions too. We have assisted living facilities, we have memory care facilities, skilled nursing facilities that are all options to help, and they don't have to be long-term. They can be, and sometimes we need that support. Sometimes we need memory care long-term, and I want you to know that's okay. But sometimes, whenever we're on our road to rehabilitation, or we're on our road to getting back to where we were previously, or to a new, what we call baseline, we can use some of those services as well to supplement. And so what I would say to you is, assisted living facilities are independent, or they could be assisted or they could be independent living facilities, are typically facilities that are in one general location. They have some support services, but they're not going to have a full-time nurse coming every day in and out of the room. They have sometimes full-time nurses on staff, sometimes they don't, but they're there to help build a community and to help assist people in their living as they're growing, which is where the term assisted living comes from. For memory care support centers are going to be a more hands-on care facility. They're going to have more support services. They are typically a little more expensive than assisted living, but that's because of the support that comes with it. Those are great options for our family members or our loved ones who are struggling with memory loss, with Alzheimer's or dementia, and need an added layer of hands, and we're just not able to do it all on our own. Skilled nursing facilities are going to be just as they're called, skilled facilities. Those are typically designed for some of our loved ones who need very hands-on care. They have something that requires the skills of a professional to help support them in their care and in their journey. And so what I would tell you is, we've seen a very interesting dynamic happen in healthcare. Skilled nursing facilities are absolutely being designed for long-term, but they're also playing an important role in rehabilitation and a very important role in helping in transitions from the hospital back to home. Not that long ago, it used to be that if you came in and you had a heart attack, you would be in the hospital for quite some time while you recovered and while we monitored vital signs. But as technology quickly increases and as the need and capacity changes on our hospital floors, sometimes we have to change a little bit too, and those levels of care look a little different than what they once did. So if you had a heart attack today, you might be out of the hospital very soon, and in that case you might need to go to a skilled nursing facility for a short period of time and then to home health afterwards, or you could be well enough to go straight from the hospital to home health services. So I say that really just as a way of communicating and trying to educate on the fact that things are changing and the way that things are perceived across our healthcare delivery system are rapidly evolving. Our pandemic, our COVID-19, has exponentially increased the rate of some of that. And what I love about the pandemic, is, if I'm allowed to say that I love something about it, is that we have really been forced as a medical community to come together and to say, I can help with this, and if you can help with this, and then you can help with this, we can all make sure that people are safe and getting the best possible outcome. Next, I want to talk a little bit about hospice services. I love hospice. I get to work with an incredible hospice team here at Hill Country Memorial. And what I would tell you more than anything is hospice is not about dying. It's not about dying at all. Hospice is about living, and it's about living well and meeting people where they're at and making sure that you're well managed and your loved one has what they need to have the best possible services at end of life. Everyone gets overwhelmed and scared when I say end of life, but the truth is that we oftentimes live end of life for long periods of time. Hospice services are designed to be at least the last 6 months. So they're designed for people who have a terminal illness. There's no doubt about that. They have an illness that likely in a normal trajectory is going to be an end-of-life illness. However, what I'll say is that there is a huge difference between someone who comes on hospice services and the care that they're provided when they're 6 months away and when they're a couple hours away. And all too often we refer to hospice services right in the final days or the final hours. And what I will tell you is that it is an incredible benefit. Again, it's one that Medicare has said we need to be using these services. There is no copay. There is no deductible for hospice care. And it is an incredible place to come together and to begin a healing process. Who's eligible is just what I said. The team that I just spoke about, or anyone who's at end of life likely qualifies for hospice. How you make a referral to hospice, or how do you talk to someone about it, really starts with a physician conversation, talking to your doctor about what's happening or what you're seeing. If you're uncomfortable with that and you just want to get more information, you can reach out to a hospice and call them, and they can help discuss with you what hospice is as well. Who's eligible is just that. Multidisciplinary team. So who we serve under hospice services, or what that looks like, is hospice was really the originator of what we call multidisciplinary teams. Hospice is designed with a nurse, and they help with symptom management, pain management, helping make sure that people are well taken care of. We have chaplains who help with the spiritual support, emotional support, and then we also have social workers who also help with emotional support, psychosocial assessments, assessments and conversations with the entire family. We have aides that help in the home or in a facility with bathing, with end-of-life care, light housekeeping, meal prep. Again, all of those things are covered under a hospice services. So our Aging Well checklist. One, you want to partner with your primary care. What I would tell you is that everyone needs a good primary care physician, someone you trust, and someone that you know is going to be an advocate for you or your loved one on your journey. It's very important that as you go through things, or something doesn't feel right, or changes happen, that you talk to your doctor, and that you involve them in helping with these decisions. Keep good records. So what I would say to everyone, and we talk about this often in the post-acute line, is that we all have ownership and responsibility in our healthcare, and making sure that people understand no one knows your body better than you, and no one knows what's happening better than you and your loved ones. So for loved ones on the call or on this video, or for those who are actually going through the steps of this, what I would tell you is keep a good medication list. It's important that you have that as you go in and out of doctor's offices. Know what you're taking and why you're taking it. We can give you all kinds of information about that. You can have a binder put together. Include your advance directives or any medical wishes that you have those conversations with your family. We want to get screened regularly. The best way to stay safe at home, or the best way to age well at home, is to make sure that you're getting your annual appointments, your annual wellness checks, you're getting your colonoscopies and your mammograms as you need them and as things go through. So work with your primary care physicians and get those tests that you need to make sure that we catch things early if they're going on, and we're there to support you along the way. There are all kinds of safety measures or all kinds of safety support services out there, and I'm happy to help if anybody has questions about this, but technology is advancing so quickly. And I would tell you to think outside the box when it comes to technology and how you can integrate that into your home. I can't tell you how many people we serve who have Alexa as their reminder for their medications. Hey Alexa, set up a reminder for me to take my meds at 8 a.m. and 8 p.m. every day. There's no reason not to. There's all kinds of things we can do. Our watches talk to us, our phones talk to us, reminders are everywhere. Technology is scary, sure, but an incredible resource to keep us aging well at home. We have lifelines that you can put around your neck, where you can press the button if you fall. Apple Watches now have fall detectors on them, and there's so much more coming out at a very rapid pace. So keep your eye on that technology and do the research, because there may be something out there that could really help you with staying well at home. We want to understand our insurance coverage. Medicare is one insurance coverage, but there are a lot of Medicare Advantage plans out there, and they're coming very quickly. So I want to talk for just a second about insurance. So we have Medicare Advantage, which are the plans that replace Medicare, or Medicare replacement plans. They work with our Medicare plan, but they are our primary payer. Then we have Medicare supplemental plans, and those plans are designed for Medicare to continue to be the primary payer, but to supplement or support our insurance. And then we have truly commercial plans for those who aren't covered by Medicare yet, or who choose or elect to take a commercial insurance plan over the others. So really work with whoever your insurance agent is to understand the benefits of what you're getting. I can't tell you how many times I've seen someone knock on the door and begin to talk to someone about insurance, but it wasn't necessarily exactly what they thought they were getting. And so we have to be aware of that and just know for sure what your insurance is before you sign the line. Want to make a plan. Talk to your loved ones. I had the opportunity a little while ago to do a video with an incredible person, Tim Boyer, here in our organization on advanced directive planning, and really take the time to make sure that your loved ones understand what your wishes are and to have those conversations. I promise if they need to use it at any point in the future, they will thank you. If you're hospitalized, make sure your primary care doctor knows and that you're working with them. We oftentimes, we do a great job in healthcare trying to communicate, but there's a lot of people working in a lot of different areas. And so what I would tell you is that we are all empowered and we are all advocates for ourselves. So make sure that as things happen, you notify your primary care physician or whoever the physician is who's managing your care most closely, so that they understand what's happening for you. And it's not just with hospitalizations, it's really with anything that's going on. If you don't feel well, that's not normal. So if you don't feel well, tell someone and let us figure out what's happening so we can go in early intervention and help support. those are the big talking points that I wanted to speak through today. My contact information is below. I have my phone number there. I think my email address is on this website as well. If not, we will add it. But I want to make sure that I'm here to walk with you on this journey and to be together. This is a small community, but we are large in territory. So we cover throughout the Hill Country, 13 counties to be exact, and we want to be here to support you in your medical needs, no matter what they are, and to help you age well at home. Please let me know if you need anything, and thank you. I appreciate the time. Bye.